Chapter 7 discusses the fundamental of medical records that can concentrate on the outpatient record, including the name of those sections along the way of this context that is included in the medical record. These are all portion and difference in addition to documents requirement, as well as those sources that are needed for information in the intake office, outpatient cover. The permanent law and regulation that will also cover identified as chapter is also important in those patient care and facilities and the obligation of those completing through those accurate documents. The objective upon this completion of this chapter, I believe students will be able to state at least the three purposes for keeping medical record. I believe students should be able to image the components of medical records, identify the purpose of each component, identify, recognize the laws and the effective laws of those medical records, process and keeping. The purpose of medical records. Your book starts off in this introduction. Medical record environment records are vital, accurate, important to patient care. When patients have an appointment, medical providers might forget what the patient encountered and are involved in the process, which can be a result of improper treatment. The medical record is a development by all participants involved in the patient encountering to provide a consistent through and documentation of events that took place occurred during the visit. The documentation is completed by administrators or a receptionist sometimes, clinical staff involved in the patient care, serving those patient, guiding those demonstration that is needed in the aspect of those demographic procedures. History, examination, diagnostic, and what else, and much more. More prominent in promoting the quality care of those patients and the importance of the quality care in the medical records serves a number of purposes, serves including a contingency care, compliance with sole sources, state and social statistic. All these are environmental of a community of care and a continuum of care within those medical records, either in paper or electronic in some cases form. It has a his or her physician or primary care. These are all samplistic or sample of those office medical documents on the importance of patient care, maintaining a thorough accuracy of medical records, helping those healthcare facility to provide the quality of treatment, the quality to pre-treatment to patients. That's more an update of through thorough medical record that provides to providers a shared medical document information on among others that represent a patient history of those treatment and others facility as well as the as facility of your own that you're working at. Every day, every time a patient's sent to a service or another healthcare facility, such as laboratory, radiology center, or physician center, or something like that, a consultation report generated for medical records and those environment settings. Also, a report is also back to those family and primary physician office, different places and different medical record. These allow the patient to primary physician and others to do providers to have a chronological record of symptoms of disease and other disorders, along with this diagnostic tests and outcomes. All these these are very important of safe treatment, as well as providing the optimum care for the patient. It serves a reference for a past. It serves a present too. Figure 7.1 in your book shows this continuity of the well wheel in which the patient or medical records are center. Our center and all services center on medical records, center on the patient events. The compliance with coding is also important in a medical record. We talked about this utmost importance in coding in chapter 6 of last week, showing those reimbursements sometimes not documented correctly in the patient medical record. Then the medical coder is unable to determine the services, unable to determine the procedure that is provided or are to be provided for patient information in the medical record. is what coding is based on. Basically, if sometime is missing, sometime then the coder will then not be able to submit for reimbursement. Means you're not getting paid. I discussed this last week. Losing those facility revenue, the coder depends on the information. It depends on the medical records. Depends on the records to be accurate, complete, in order to justify the medical necessity and necessitation of service procedure that provides a patient record, that provides a patient service, that provides to the detail of the specific nature of the treatment, specific patient, in order for coders to achieve the highest level of procedure, the highest level of diagnostic. It needs to be accurate. It needs to have a medical coder, the code to be the highest level of process, specificity, the diagnostic of those patients, the diagnostic of those documents, the correct diagnostic, basically what I'm talking about. The procedure are also importancy, compliance importancy, insurance carriers coverage and importancy, determine the policy of each insurance carrier, determine reimbursement that provides a different requirement, that provides the code that must understand the different differences to be able to code the service procedure, code the diagnostic procedure according to the medical record. Importance of source of statistic research is important of those development of new curves, new procedure, new medication, the information gathered in those facilities during those research too can also be used as a predictable predict to need a service given. All these one-way gather information, statistical purpose is converted into a procedure, converted into a diagnostic, converted into the patient medical records, into a code input, and then into a computer, becoming a source of statistical for various students studies and patients and staff studies that can help determine the cluster of disease. The flu season is coming, and we just still have severity of allergy and also COVID-19 upcoming for the winter. To determine to prove this, to receive approval of healthcare facility in the area, such as cancer center. Another benefit to using this statistical information for service procedure can be for the purpose of identifying diagnostic types. Well, what I mean is treatment are able to help, treatment that needs to be able to help, severe patient chronic issue, severe ongoing study that needs to make the patient easier life, easier healthcare facility to make identify, to improve for doctors, the patient, and treatment of options based on the medical record, diagnostic testing that resolve the treatments, enter into what? The medical record, encoding diagnostic of those in each area. The documentation of which medical records is thorough, accurate, that is, can be tremendous a resource to development, statistical purpose, information for the hospital, for the medical, or the future of medicine. It is the parts of the medicine record is consistent that is necessary for the patient and medical to record, to maintain, to accurately those information recorded regarding the patient, regarding the medical background, regarding the facility process. You can think of those medical records as being divided into an administrative section, for example, and the medical of those clinic section that starts the medical record. Think about it. That begins when the patient walks in the door, makes that first contact with an appointment over the phone, when the office with those complaints or requests for those medical encountering also provides those demograph, also provides those information that is needed for all information to be obtained during the appointment scheduling, entering into the medical record, entering into the administrative process and clinical section. All these are generated as a result, despite the different sections in the medical record. Each area must be documented appropriately, must reflect the patient appointment, must reflect the maintain the accuracy of those information regarding to the patient, regarding to the times of maintaining of services of those identifying the payments information and all document in the medical record. This will allow the facility to understand to ensure a proper trust, a proper accurate process administrative section of medical that is needed for the records to justify the importance of those medical clinical section without identifying the demographic, without identifying the information. Listen, folks, such as the patient name, birthday, documentation that on the misplaced result in poor treatment. Listen, if it's not recorded in a proper way, if you have a problem with payment facility, the patient might have allergy now. The patient was not recorded for allergy, a certain type of insulin or whatever to maintain. This can cause death. These demographics are so important for a function of the office that should be checked in the medical appointment, should be checked in the intake registration form. A patient registration form is used in a physician office, other outpatient setting environment. It has very, very importance, essential to the important documentation in determining insurance information, billing information, patient identification. And I already mentioned the big ill death that include misdiagnosing, full name, address, telephone numbers, date, birth. All these are so important. The gender, the place of employment, emergency contact, marital status, registration. I mean that includes subscribing to the insurance company, how what the copay might show the difference. So this way, the subscriber address is not only located in the insurance card, it is noted that for the patient not to be overcharged or understanding, especially copay, addressing the different formality of patient in addition to subscriber of those employment. Also to the describing to the specific needs of issue insurance information, insurance registration, insurance that includes the name, address, matching those to the identity, telephone number, matching those to the insurance carrier as well as the ID number, the policy number. These all include the information in the medical record, information written to the registration form, patient form, guiding that should be confirmed by matching with those insurance card, matching with also the copy that is kept in the patient file record. Other parts of the registration form include signatures necessary to release the information or not to release information that provides providers for insurance purposes permission to bill the insuree, to bill the insurance carrier, the permission to treat the patient. All these are processes. The registration form includes a section of the patient, includes his or her previous medical history. These all follow through with the passing of the Obama Act, able to transfer medical records from the hospital and to places. The figure 1.3 in your book shows the patient registration form, how it's supposed to be filled. You need to pay attention to that. Insurance cards, insurance care, all these you want to take a look at in figure 1.3 that provides those information in your book. Subscribe the degree, the dependency that shows the making of those appointments, the patients. They're assessing his or her insurance, assessing his or her intake causation for coming in. Again, those telephone number on registration, that should be presented already in time for the first appointment, in time for the first emergency to ensure the medical record. So you want to write the word medical record because this is what Chapter 7 focuses on, the patient insurance history, insurance card, provider, telephone number, name, ID card, all these are well as copayment amounts, all these are primary care physician emergency departments focus, emergency specialist focus, the frontline focus, the main office card also is focus, subscriber focus. These are sometimes misplaced. A birthday, for example, that's needed in the billing, needed in the emergency process. To know the age of a patient, whether she can give consent or not. Provide those importance, telephone number for those consents so the consenter can be reached. At the first visit of healthcare facility, patients should be able to ask these questions, or you as a staffer should be able to ask and answer these questions, identifying these questions, identifying the resources of these questions needed registration and billing information sources. They need to ask. Write that down as you use in your discussion. I'm gonna stop now at 6:12 to see who's participants here today. And if you are speak now, if you have a question, I'm gonna go in the chat room and also check is there any chatters, chatters in the chat room. I don't see any question in the chat room. Understand that as you come back into the Zoom or you come back into the chat, you can use the chat when you enter. If you're entering late, please mute. So this way I can focus on laying it down for you in chapter 7. The information to be shared are checked, as I repeated, checked on insurance, checked on carriers, checked on process, on ID, patient willingness, releasing those information, transforming medical records from hospital to physician to a smaller office, outtake office, intake office. These are all so very, very well important to see. Copying those front and back of the ID, front and back of the new card of the insurance, or updated old financial record for the insurance, all aspect of medical records that could contain so much information about the patient. Corresponding in medical records can come from many sources that includes medical and non-medical. Think about that. Documentation that can come from insurance carrier, requiring further clarification of claim respondent, maybe from other health institutions, healthcare providers, concerning the care of the patient of if can even be from patients. When responded in a patient medical record, be sure to include appropriate information to identify the patient, including the medical history, the non-medical corresponding history. The document should be included in a patient legal name for, as I repeated, the focus identifying the information need. I'm going to repeat it because it's very important as an administrator that you understand this documentation process, and when it's missing, the necessary, unnecessary that it causes. The non-medical correspondence that does not pertain to medical treatment of a patient may be kept in a separate file, in a separate section of a chart. It does not have to be included in those information because it's not medical information. The process of this medical physician, in addition, there's medical correspondence should be in the appropriate file, appropriate section of the medical record, a chart, that depending on the type of the document and the date. Although the correspondent does not always affect the care of the patient, it is just important to your process of medical records for the patient and for the hospital and for the submission of those insurance claims, considering those documents that should be accurate too, as we mentioned before, complete at all times. If the medical record has been brought to a court, for example, the correspondent was missing all these information we're talking about on the file, the medical record will be considered incomplete. It means you lose your case. Negative impact. The court proceeding would just dismiss the case in most cases. Any document pertaining to a patient should be appropriately, immediately, upon receipt of obtaining accurate information on the medical record of the patient. Processing note, progressing notes, and all is part of this medical record, which physician, nurse, and other healthcare division, other clinical process records, a patient, a chief complainant, a brief description of the current illness, a history of the pertinent illness, and also finding those examination process. Notes that serve as a summary of the process, summary of those diagnostics tech, the treatments, outcomes that shows the progress, that shows the notes that indicate diagnostic and process of treatment, process of those different options. Each entry is dated and assigned. Healthcare providers, these progress notes, these sections of medical records, notes the speciality, importance of that must be comply with the law, regulation of fourth of the insurance carriers, the state law, the federal law, the governancies, current procedure, terminology of CPT. We talked about coding, the CPT coding for procedure, service performed, the physician performs, other care performed, provider which nurse care. All codes have clear documentations, guidelines, processes. What medical record must contain to justify the billing, justify the service, to justify the procedure, in addition to those classification of disease, clinical, modification, MODI, ICD diagnostic codes we talked about, determined from those progresses and progress. Notice provided those documentation of the patient diagnostic signs, the symptoms, without proper documentation, without proper CPT, ICD diagnostic code, we cannot determine. The revenue would not be determined in counting and we lost billers and coders not involved and then the patient's present in his or her appointment. Therefore, they rally on through documentation to get those codes, to get the accurate, those complete billing purposes. Many types of progress notes exist, such as subjective, objective assessment, plan, the SOAP notes, consultation letters to other providers, dated those paragraphs, and more with documentation of those in those progress, documentation those in those notes. Be careful, sometimes those abbreviation document can be documented immediately and do not wait for anything because it can also cause an addenda for mistake accordingly to those documentation, accordingly to the process of reflects on added information addenda all through process come through different formats. The information they need, that what you need to include regarding a patient, a similar disease similarities. Just be a part of any progress. Noting those healthcare procedure, healthcare facility, utilizing the process documented. The record formats when those documentation you need for a patient and in formats that should be sure that all information is accurate, pertinent to the patient treatment, pertinent to the patient outcome. Thoroughly accurate documenting your book calls using determination formats, identifying the necessary information, the healthcare facility, the information that is needed that must be, identifying the section of the progress, noting those includes not only to exceed the documentation but exceed requirement. These are required elements that must be included when a physician documents a patient problem. Diagnostic headings are for all elements that can be recorded in the physician process sheet. We talked about pre-printed templates, history, examination portion to assist the provider in remembering the documented process of the previous process. There are also different format, documentation elements which allow the provider to investigate, to choose the method that is appropriate for them while they're still completing the requirements for the patient. The patient medical record. Table 7.1 comprises and shows those elements I'm talking about. The documentation element uses those SOAP, SOAP, the chief complaint officer we talked about, explaining detailed drugs assessment process of those chatter system formats. It's called in your book. When looking at these tables, you can see that the same information is recorded just in a different format. Another way of documentation, the element is a problem oriented in the medical record. It's called the POMR, which elements provide a list, treatments, and outcomes. You can see this in figure 7.2, very explanatory with reference of those patient and medical record, reference to those identifying the medication and process and history as extremely very, very well important. A patient in which some medical records, the medication history is not only apparent, however, having a medication of record can avoid those mistakes, avoid those care facility mistake. The medication record is a form that lists the medication and patient taking what the patient is really taking, as well as doses, frequency, method that's used, administrative from on and on. Records that date medication began, whether medication began as a date when it's renewed or discontinued, for example. You can actually see this in Figure 7.3. Creating and recognizing the trail of medication for those patients can be beneficial. Not only beneficial to the patient, but treatment. When the patient needs a refill, the patient needs an extra information or doses regarding information can be obtained to compare comparable what patient is using, requesting, providing, what's happening, considering adding medication to the patient, the treatment. All these are very important. It will be on those records. Showing a separate list of currently prescribed medication can help provider quickly identify problem that may be associated with prescription, associated with the problem. Although we may be sometimes consuming to keep the separate log. In the end, this is beneficial to all involved staffs and diagnostic staff. Test many diagnostic tests that perform on patients to try to assess those signs, the symptoms, status, condition, and those diagnostic tests and routine. A part of this patient, he or she has a complaint. That's another warrant for further investigation. Many situations, a healthcare facility or provider can determine a patient treatment option when they are there in confirmation of the condition, confirmation of the illness through the diagnostic testing. These are because of a technology advancement in medicine too. Many diagnostic treatment has been able to treat patient and see unexpected events even years in advance. Medical's corresponding diagnostic testing results are returns to a healthcare facility, for example, to the patient medical record field and the diagnostic testing record section. All these the part of medical record that is needed and it houses all these diagnostic tests. The patient has had a connection with illness, injury. These tests can be formed from a diagnostic laboratory, from a hospital, a specialist. These records assist physician diagnostic treatment, diagnostic process, diagnostic providing medical necessity service to procedure that is needed for diagnostic test importance. Good evening, my lady. You have arrived late. How are you doing today? Let's see you.
Hello?
Hello there, Maria. How are you? I'm happy to see you
Hey,
join the
I'm well.
class.
I'm sorry that I'm late.
Yeah, you're late and you're missing a whole bunch of assignment. Sample all these. You need to turn your
Oh
assignment
my
so we can
God.
get you passing this course sooner or later.
I will pass, but it's something. I will explain to you next time what happened. But I'm working on it. I'm almost done with the
Well, go ahead
assignment.
and turn them in as quick as possible. Some of them are way beyond late.
I will.
If you're having what's the word I'm looking at? Emergency that's physical or detrimental to your health, I can give you excuses for a couple weeks. But you gotta let me know what's going on. Open line communication provides a accuracy to your success in this
I
course.
understand.
Okay,
I
I am
understand.
covering chapter 7. I'm almost done with it. I already laid into the last 25 minutes. We're talking about medical records, the patient means of hospital records. These should be included as a part of the system and it must be accurate. So when you write your discussion this week, focus on this, especially the involvement of having accuracy, diagnostic accuracy, and effective having those the coding accuracy and billing transferable to the provider of insurance that he's encountering in hospital. It is not pertinent to healthcare facility providers also. The facility that provides this health insurance must be able to diagnose by codes the patient history that seeks reimbursement for treatment, diagnostic for his or her healthcare in this facility. These very well, the hospital records section should be included in these patients' medical. These are transferable documents that follows the patient, contains identity, information including the birthday. These what are actually already repeated in the early introduction of these lecture. We be physician office record. All these must be accurate. It is the mission of discharge, recorded a fast sheet, a face sheet, operation diagnostic service, procedures that perform in those facility in the records with coding, history. All these are very well, all very very well important. This includes medical record for every patient who is admitted, hospital history, physician, the HP is what your book calls it. Explains the medical reasons, explain medical admission, explain the history part of the report in those documents, the reason of the chief complaint sometimes. These leads to the chief complaints, and documentation includes the patient past history, family, personnel, social history, as well as a review of the history of the patient, system of the body of the patient, physician portion. This report the physician might use to examine conclusion and process of the permanent body system of the finding. This report requirement from Joint Commission for Hospital Admission sometimes shows these properties, despite of the history, is dedicated to the provider. If you look at Figure 7.5, it shows explain a history of physician report, an admission process, admission discharge process, a record that shows a face sheet in your book as a part of every hospital admission, as a part of every hospital discharge that needs a documentation of those admission and discharge. The record also is known as a face sheet in our field of records. This is a summary of patient encountering, as I discussed, just not too far away. So you want to write that down, showing the discharge, the patient medical status, discharge of appropriation, discharge of summary. The portion that the record shows include a diagnostic process before the admission too. It also shows the diagnostic upon discharge, both. So as you write your discussion, you want to use these procedures to show the determination of discharge versus discharge and coming in. In addition, the dates that shows the codes in those diagnostic procedure that is needed to identify for insurance provider contains a demographic, is what your book called, a demographic of information of the patient, such as address, birthday, the social security number, and the marital status, and also address, telephone, where I think I already covered that. The number of the employer. These are all needed upon discharge, as well as admitted physicians. The financial information is not only important to understand how you're going to charge a customer, it's also important to you in case of emergency. I actually discussed this already in the opening. What if the patient, you didn't ask the patient and the age, the patient looked like she was 24, but she's not really 24, she's 17. Now you cross the line in regulation of having a parental permission, having a second permission. So ICD diagnostic codes attached to those, we recognize the face sheet that includes condition, age, patient, discharge, what's going on, right? So we are to be very not only accurate in the processes of writing of stuff in the intake office with the nurse or receptionist doing so. We have to, because the law and regulation shows this as a rule of thumb that needs to be followed to avoid mistake that causes malpractices. There are a number of different entities and entitlements that governs these contact that releases those medical records to another hospital. With the passing of Obama Act, these are published on the Center for Medicine that travels from hospital medical, the CMS, in the form of national coverage for safety, identifying, giving service procedure of medical record. And throughout this, reimbursement happens. And reimbursement means how the hospital gets paid, accessing those medical records, accessing those medical website, the CRT. If you're looking at Figure 7.3 of your book, it shows those process assistance the laws and regulation of the process and those healthcare division and healthcare process, all importance in reaching and researching, understanding the focus of the assets in the medical record, of trustworthiness of those. Your books also lists the different website that shows the governmental regulation sites, facilitating to be sure the source is right, current. It's always good to visit those websites. The American Medical Association, the AMA, as publishes the CPT annual report. You know, the CPT stands for Coding Manual. That lists the procedure of those services performed in the outpatient setting. Each of these six sections is preceded by the guidelines using the codes. The Healthcare Common Procedure, the Healthcare Coding System is called a HCPCS coding book. It's another manual that can be utilized to identify the rules, the regulation, the medical records we're talking about, the documentation process we're talking about, the billing, and also the coding, the purposes. The HCPCS manual includes an internet-only manual, the IOM. You want to write that down. That shows the changes of recent laws that has been made. Shows a previous guideline that can be accessed online through the CMS organization. The manual of the IOM, the addition such insurance information development. Those development its own rules that goes in rules and documentation. All these are available at the current website. And each one of you are obligated as a healthcare administrator to facilitate those information, identify those information, identify those requirements accordingly to one policy, to the policy, maintaining the current information pertinent to everyone involved. When healthcare facilities are provided, identify these changes in laws and regulation. It is their duty to ensure all administration, all clinical staff are well managed, well aware of the process accordingly. But without it, improvisism occurs. So in conclusion, it's necessary between healthcare professional as well the importance of compliance, the importance of process, medical code, a medical record, reimbursement process. The medical record serves as a source of statistic used to determine the cluster of disease, as well the need for additional healthcare services in these environment facilities that we work in every day. The medical record has an administration section that contains patient registration, copies of front and back of those insurance cards, acknowledgements of receipts, all these notices of privacy. These section ensures compliancy, ensures confidentiality within the regulation of the HIPPAA regulation. The medical clinical portion of these medical records includes, as you write this down, the progress of notes, the problems of record, the problem of recording of medication record, all reports of diagnostics tests, the information that is necessary in each section is not only important for diagnostic treatment, important for the patient evaluation. It is an outcome of the illness. The medical record must be complete with all insurance information, government and state laws which facilitate the local laws. So as I end this chapter 7, I hope you've taken some notes and you can rewatch this chapter 7. If you have any questions, I will take questions now.